The 153 new cases of COVID-19 reported on Wednesday constitutes one of the highest daily figures recorded in Laos since the start of the pandemic in March last year. The government has extended the partial lockdown until August 3rd in a further attempt to reduce the number of infections and contain the virus outbreak.
สปป.ลาวเฮามีจำนวนผู้ติดเชื้อสะสมทั้งหมด 3,863 คนซึ่งในนั้นแม่นกวดติดเชื้อใหม่ในมื้อวานนี้แม่น153 คน
The new infections bring the countrywide total today to 3,863, while 1,322 people are currently in hospital for treatment and observation, according to the National Task Force for COVID-19 Prevention and Control. Within 152 new infections were identified in migrant workers returning to Laos from Thailand. 1 new infections. Savanakhet reported the highest number of new cases with 93, followed by Champasak province with 36, Salawan province with 13, Vientiane with 1, and Khamon province reported 10 new cases. 5 deaths have been reported to date.
ปัจจุบันเห็นว่าการติดเชื้อในชุมชนอยู่ในนครหลวงเวียงจันทน์และแขวงเวียงจันทน์มีท่าเอียงลดลงแต่เริ่มมีรายงานกรณีติดเชื้อในชุมชนอยู่แขวงจำปาสัก
Positive test results were obtained after 1,511 samples were tested for COVID. At least 2,000 people were admitted to quarantine centers across the country, and samples taken from them have been sent for testing. There are 48 quarantine centers throughout Laos, where 6,044 people are currently accommodated. No more villages in Vientiane have been classified as red or yellow zones. The government has extended the partial lockdown until August 3rd in a further attempt to reduce the number of infections and contain the virus outbreak. Health authorities advise everyone to act responsibly and to support the battle to prevent the virus spiraling out of control. Meanwhile, the vaccination program is being expedited to ensure that 50% of the population is immunized by the end of this year. The COVID-19 task force says everyone must maintain social distancing, wear a face mask, and comply with all the guidelines imposed by the government to lower the risk of contracting the virus. People who need to leave their homes are advised to wear a face mask, regularly wash their hands with soap, and avoid touching their mouths and eyes.